And are there two versions of stress test? Isn't one like I guess you were saying the injection, like my mother can't exercise, can't walk, let alone get on a treadmill. So that's the injection where they force your heart to beat fast.
Right. Yeah, they use like an adrenaline equivalent to make it beat fast. Now, the issues there, and the reason I didn't even include that is because it's not really a predictor of heart attacks or heart disease or anything really. In fact, everybody does stress tests all the time. You just walk down the hall, go up the stairs, whatever you're doing. If you go, gosh, I can't get top of the stairs, I get chest pain, I can't breathe. Okay, that's your stress test. You got a problem with the heart.
Hello, everyone. Welcome to the webinar today. We're excited to have you. This is our weekly Healthy Heart webinar. And you have Cheryl.
Hello.
Me.
Leslie.
Dr. Saunders. He's adjusting his camera. He's got to get his look just right. There we go.
Yeah, there we go.
Perfect. Well, thank you guys for hanging out. We're a little bit late here to get started, but we're super excited. And this is a very important webinar because we are going to be chatting about testing. And I like to just call it testing for cardio health, really. But Dr. Saunders is going to share. He sent us over a very large list of, I have so many questions already. And I love it. Actually, he sent us, this is funny. In the text that he sent us, it says, okay, I have all the webinars mapped out for the next year.
He does.
Yes, he
Stay
is.
Tuned.
Yes.
I looked at some of these items. I was like, I can't wait to hear all about this one and this one and this one. Yeah.
But it also is just reminding me again that Dr. Saunders, he loves this. Can we call you? Sometimes I get to see these little glimpses of Dr. Saunders, and I'm just going to say this, where he kind of geeks out a little bit, and I've seen it. This is one of those moments. I think this is one of those moments, but that's what we love about him, because this is the stuff he loves. And so he's so fun to talk to and learn from, because this is his world, and he researches and he gets to the root cause of things. And I just am so thankful for him. So you guys are in for a treat again. This is our episode 4 of our Healthy Heart webinar. So if you missed the other 3, no worries. You can find those at bartonwebinar.com. There's a link to our YouTube channel, and you'll be able to go find all of those. So we also have 190 episodes where we talk about type 2 diabetes. So if that's of interest to you, you can find all those. You may even see some customer testimonials, we call them. But some of you who have been on the webinar who have completely changed your life through Dr. Saunders' recommendations have been able to hop on a quick little video and share that. And so some of those you will find on the YouTube channel. So, okay, I think that's it for this. Actually, I want to do a quick disclaimer, and it's just this. Dr. Saunders isn't your personal doctor, so be sure to consult with your medical professional when taking any of the advice that's shared here today. Is that simple enough?
Yeah, that's simple.
Okay. And I also like to just add to that, because I hear Dr. Saunders say this all the time. Everyone is different. Everybody's body is a little bit different. And so what works for one person may not always work for the next person.
And you know what? That is so important, because that's the problem. That's a foundational problem with heart disease, is we lump everybody into a category of heart disease. And that lumping doesn't take into account the differences that everybody has. Some people have diabetes and that's affecting it. Some people have genetic factors that are affecting it. Some people have infections that are affecting it, or inflammatory conditions, or arthritis, or food choices, or, there's so many factors involved, and we just lump everybody together. Oh, you have heart disease. Here, take a pill. That doesn't work. And that's why we're here, is to tell you, to help you ferret that out and say, okay, where do I fit in this?
Yes. Mm-hmm. One of the things that came up on our last webinar was often when people will go to see a specific doctor, they may find, maybe they're going to do some heart tests. They aren't always looking at the entire body or the whole person. And so there's always a lot more going on than just one specific thing that you may think is the issue. But you want to find a doctor or listen to some thoughts, maybe from Dr. Saunders, about looking at the person as a whole person instead of just this one little thing that could be affected everywhere, right? So,
And really,
okay.
being here is taking care of your own health, is taking control of it. Because if you just listen to one doctor, you may not be on the right path to heal you, and you know whether or not it's working in you. And sometimes you got to go through different doctors to find the right one. But being here means you're going to find new information to help you. And that's important.
Yes. And ask questions. That's why we're here. We're just so excited that Dr. Saunders is willing to take time to do this. So get your questions ready. You can post those in the Q&A, in the comments on Facebook. YouTube viewers, post those there too. We're going to do our best to get to as many as we can. So with that, let's get started. We're going to talk about testing. Dr. Saunders, what do we need to know? Where do we start? How do we know if our heart is even healthy?
Okay, well, testing is the important part. So this is where you find out who you are and why you have heart disease, because it's different for everyone. And there's no two people that are alike. So the testing is what decides, which one you are, what you have. So when we test and we look at hemoglobin, for example, some people have too much hemoglobin. And what does that mean? Their iron levels are too high. And when their iron levels are too high, they get more inflammation, and it damages the lining of the blood vessels. And that damage to the lining of the blood vessels is the problem of heart disease. So when we're testing, one of the things that we're looking at is what can damage the lining of the blood vessels. And then another thing we're looking at is what can prevent repair of the blood vessels, because you can damage the lining and it could just repair, and that's what happens normally. So then the question is, okay, it gets damaged, well, why doesn't it repair? Because it should just repair like everybody does. You get a cut and you get a scab over it, and then the cells grow together underneath it, and a few weeks later you look and there's nothing there. It's like gone because it's all repaired. That's what's supposed to happen internally in your blood vessels as well. And so part of the testing is to find out, well, why didn't that happen? So why does it get damaged? And then why doesn't it repair? Those are the two primary things. So the test that we do, we're going to have to include a list because there's a lot of tests here, but I do want to explain each one of them somewhat so that we understand. So the first one I already talked about, like hemoglobin. Like you need to know the hemoglobin's normal, fine, not an issue. But if you're anemic, that's meaningful because that can prevent repair. Because if you don't have enough iron, we think of iron as just the red blood cells, but iron is needed for the mitochondria to make energy as well. So if you don't have enough iron, then you may not be making enough energy. And if you don't have enough mitochondria making energy, that can affect your heart. It can affect your repair of your blood vessels as well. And so people can get into what's called congestive heart failure or heart failure from not repairing their blood vessels or from not getting enough energy to their heart. Another thing is the red cell distribution width. Now that's an interesting thing. What that means is you have these red blood cells that are all about the same size. But you know what? When you look under the microscope, it looks like they're all the same size. They're not the same size. And I got to tell you this, the ability that we have now to measure them is not just someone looking under a microscope and then they have a little ruler there measuring each one of the red blood cells. That's kind of the old way they used to do it. They used to, actually look under the mic. They do a smear. They smear out the red blood cells, and then they look at them and go, kind of measuring around. Now it's amazing. They run these cells, all the cells. They just put blood. They just take your blood and run it through a capillary tube. And there's a laser there. Actually, there's more than one. And the laser is measuring all kinds of things. So you look at the size of your red blood cells, and it tells you the volume of your red blood cells. Mean corpuscular volume, that's the volume. And it'll tell you that it's 2.567 femtoliters, and a femtoliter is 1/billionth of a milliliter. So it's measuring them, and then it'll tell you, well, there's more that are like 5.025 femtoliters, and there's some that are 2. Therefore, your distribution width is wider than expected. In other words, your cells are varying sizes and they're too variable. And that's an indication that there's a bone marrow abnormality. And sometimes it's a methylation problem like vitamin B12 or folic acid, or it could be a toxic problem like homocysteine. So that's a measure that most doctors kind of skip over. Yeah, your RDW is a little big. Oh, well, and move on without saying, hey, that might be a clue, just a clue as there might be some risk for heart disease here. The next one to measure is albumin. Albumin is a marker. Well, it's the amount of protein, a certain type of protein, albumin, that's in your blood. And what this protein does is what keeps the circulation going, because the albumin is what brings the water back into the blood vessels after it's been leaked out in the capillaries, and then has to come back into the veins to get back up to your heart. So that it keeps the circulation happening to some extent. It's also a marker for your ability to make proteins in your liver function. So if your liver's not functioning well, or if you lack amino acids, or you just don't have enough protein in your body, then your albumin level might go down. And so it's important to understand what your albumin level is, that's normal. If it's not, then that could be a clue that there's something wrong with your liver not making albumin, or some protein absorption, digestion, or utilization problem. The next one we have on the list is antiphospholipid antibodies. Now, this is really important as the autoimmune. Remember, we were talking about damage to your arteries. Phospholipids are everywhere. Your blood vessels, the inside of your blood vessels are lined with cells, and the cells have a membrane around them, and that membrane is made of phospholipids. And if you have antibodies against the phospholipids, then you're going to damage those cells that are lining your blood vessels. Most of the time, it's not a problem. But whenever there's a break, whenever there's a break in the glycocalyx that protects the lining that protects the inside of the cells, then those phospholipid antibodies can get in and cause a reaction. And that reaction then prevents healing, and can cause more of a break and more of a problem, and then collects calcium and collects cholesterol, and that's where the problem begins. So sometimes the autoimmune disease is an issue, and that's why people who have heart disease, especially if you already know you have heart disease, you should test for these antibodies and find out if that's the problem. The other one is anti-cardiolipin antibodies, which is a similar autoimmune process that causes inflammation. And so, as researchers are doing more research on heart disease, they're saying, well, really, the cholesterol is not a problem so much as inflammation. And they're going, so maybe inflammation, we should start focusing more on inflammation than on things like high blood pressure and cholesterol. Because these, like autoimmune is one reason, but there's a lot of forms of inflammation that cause damage to the arteries or prevent the healing of the lining of the arteries once there is damage. Because damage is always going to happen. That's going to happen. And as long as it repairs, you get damage or repairs. You get sick and you get well. That's the expectation. So what the question we're asking is, well, are you just getting sick one after another after another after another? did you get sick once and you're just not getting well and it's just like prolonged? Those are the things that we're looking at. And anti-cardiolipin antibodies can cause that inflammation and just prevent you from getting well. It just goes on and on and on. Another one is a genetic marker. It's actually, you don't look at the gene, you look for LPA, it's lipoprotein A. It's often called LP little a because there's a lipoprotein with a capital A, and it's usually A2 or whatever, but anyway, the LP little a is a genetic marker that you are more likely to get heart disease if you have this lipoprotein A at high levels. So most people have relatively low levels, but if you have high levels, then there are things that you need to do to lower it. And we'll have a webinar on LPA specifically, because that's going to be a big one for genetic markers. So I would recommend, if you haven't had this test and you have heart disease, go to your doctor and have your LPA tested. Say, I want to test for LPA, so that when we do the webinar on LPA, that's not going to be next week, you'll have plenty of time. When we do the webinar on LPA, you'll be able to say, oh yeah, that's me, I need this, or if we already do it, doesn't matter, you can actually go back and look it up. So, and watch it. So we'll do one on that. The next one is fibrinogen. Fibrinogen is a marker for inflammation in a way that is clotting. And this is really important because we're forming clots all the time, but you don't want clots to happen in your blood vessels, in your arteries, in your veins, because that causes plugging and other problems, of course, like strokes and stuff like that. So you want to know what your fibrinogen level is. It's just a marker. It's not the actual clots. It's just a marker for you're creating clots, or you clot easily. It could be an issue. And the next is the CRP, C-reactive protein. And the test to look for is called HS. It's high sensitivity CRP. And ideally what you want is less than 1. So this is like the lower the better. It's really interesting when research is done on this particular inflammatory marker. It's called inflammation, but really they found that it's not as simple as inflammation like other inflammation tests. This is looking for cellular distress. And so some people that don't have a lot of inflammation but have allergies can have a high CRP. Or, for example, with type 2 diabetes or type 1 diabetes, when the cells are in distress, either because they're overloaded with glucose, they're just too much glucose, then they're overloaded and they're ready to burst, and they have some distress. Sometimes, fatty liver, and that's related to the CRP being elevated. So it's not inflammation in the same way like a sedimentation rate would be inflammation of like arthritis or lupus or autoimmune diseases. This is an inflammatory marker for cellular distress. And that's why it's so important that you know what that is. And we'll have to have a whole webinar on that too. Another test is serum magnesium. Do you know that magnesium is a very common deficiency in the United States? And the reason is because we don't have a staple food that is high in magnesium. Everywhere else in the world, they have staple foods that are high in magnesium. Either they eat greens every day, or they have beans every day, or they have some kinds of seeds or lentils or whole grains like brown rice or whole wheat bread or whole wheat whole grains generally. So anything that grows, any kind of seed, including grains and beans and nuts and all that stuff, and anything green, the color green is what magnesium makes that color green. So those are the things that are high in magnesium. And in the United States, our greens are, iceberg lettuce that has practically no green in it. It's almost more white than green. Whereas if you have something like spinach or kale, those dark green ones, that's where you get a lot of magnesium. And we don't use a whole grain as a rule of like wheat or rice. We use white rice and white bread and white pasta. And so because of that, we really don't have a source of magnesium as a people. Of course, you guys are all eating whole grains and whole foods and greens and all that. So I'm preaching to the choir here. But serum magnesium, you should know. And, the serum magnesium is not a good indicator of your magnesium stores in your body. That's not the way it works, because your system, your endocrine system, is going to keep your magnesium at a very tight level. But when it's on the bottom, if you measure both the serum magnesium and the red blood cell magnesium, and you have the two of those together, and you have a significant drop, less serum, you have your normal serum magnesium, and then your RBC magnesium is also normal, but it's on the low side of normal. That's an indicator. It's not great, but it's an indicator that you probably need more magnesium. And a lot of people find when they take magnesium, it calms them, it relaxes them, they sleep better, they feel better, they don't get cramps. So if you're having cramping, or especially if you've ever seen people, or you've ever had your eye twitching, that's often a sign of having low magnesium too. So yeah,
we do have a product of magnesium, by the way. You can go to bartonnutrition.com and find it. It's a spray. I think it's one of our favorite among the team. It's one of our favorite supplements. Just a side note.
Yes.
Yeah.
And one of the things that I love about it too is that, correct me if I'm wrong, but when you're using it, on the skin, it's bypassing the gut. So you don't get all of those inconveniences, I guess, of taking too much magnesium on your gut. So, and by that, I mean maybe diarrhea.
Yeah.
And I was going to mention something else. You can use code webinar25 to save 25% on any of our supplements. And I will post that in the chat as well. But keep going. This list is great. And guys, I did post the list in the chat.
Oh yeah. Okay.
Yes. So that you guys can see it. And I'm trying to spell out some of those words for you guys too. So.
Okay. The next one you need to know is homocysteine. Homocysteine is a toxin. It's a marker. It's a waste product. And then it's a marker for methylation. It gives you sort of an idea of your methylation status. And everybody goes, what is that? What's methylation? Methyl means a carbon. That's really what it means. It's a carbon with the 3 hydrogens on it, and that's called a methyl group, right? And your body takes that carbon, that methyl group, and attaches it to things. And it's the switch. It's the switch for a lot of things. It turns on your genes, it turns off your genes. That's epigenetics. So you can turn on a gene if your body needs it. Like, for example, if you need to switch from sugar burning to fat burning metabolism, you're going to need to methylate some DNA to turn on some genes and turn off some genes so that you can make certain proteins that are needed to use fat for energy instead of sugar. So that's going on all the time, every minute, every microsecond of every day. You have trillions of this, hundreds of trillions of cells, right? 100 trillion cells roughly, all making these changes all the time. And you need this methylation. And this is the vitamins, vitamin B6, B9, B12. Vitamin B9 is folic acid. So those 3 vitamins are essential to the functioning of the body. And they do slightly different things, but they're all methylators. And so if your homocysteine level is high, then you probably have a methylation problem. Probably, I say, because there are other reasons for it, but the primary reason is usually something wrong with one of those 3 vitamins, well, one or more of those 3 vitamins. So you need to know your homocysteine level. Potassium. Potassium is something that is absolutely essential for the functioning of the heart. You have to have a constant level of potassium. Potassium it's kind of like the voltage of what runs everything. So, if you have a light bulb and you turn it on, and normally it's 110 volts, but you only have 50 volts today, then your light bulb's dim, right? Now you have this dim light and you're squinting and you can't see everything. Well, some people, when they have low potassium, they run on low voltage. Essentially, their body is running on low voltage. So that's really important for the heart, because the heart needs that constantly. And if it can't get it, then you're going to get heart failure. So the problem with measuring potassium is when you look at the potassium level, it might look okay. It might be in the normal range. So there's a couple of things to look for. One is the sodium to potassium ratio. That's one. And then the other one is the red blood cell potassium, the RBC potassium, because that's the intracellular potassium. So then you can see the difference between the extracellular, which is usually 4, and then the intracellular, which is like 2000. And so there's a huge difference, and that's the voltage that allows the muscle cells to work and the heart to beat, for example. Okay, then you need vitamin B1 level. It turns out vitamin B1 is really important for the nervous system to function. And vitamin B1, we have it in our Nervala, has benfotiamine, which is vitamin B1. And so you should know your B1 levels, because when the nervous system isn't functioning, the heart doesn't function. Then there's one called factor V laden, and that's a clotting problem. People who have thrombophilia, it's called, they tend to clot easily. That's factor V laden. And then heavy metals test, or at least a blood lead level, because heavy metals is something else that could block the energy and prevent the heart from functioning. And then I always add on a CAT scan. It's called a coronary calcium score. And the coronary calcium score gives you a number that you can look at that tells you how much atherosclerosis there is in the arteries of the heart. That's a pretty cool test. What they do is the heart's beating, right? And you're sitting in a CT scanner, and it's just the heart's gonna be a blur. So what it does is when the heart relaxes, it takes a picture, and then it goes around at that rate, so it relaxes, and then it takes a picture. So it does like a series of pictures, and it gets a volume of how much calcium there is in the arteries. It actually looks at each one of the arteries and tells you how much atherosclerosis there is in the heart. And I found it to be a very useful test, mostly because if it's positive, then you say, okay, there's atherosclerosis here. We need to do something about it. If it's negative, then it's like, I don't have heart disease. We're good. So then, because a lot of people, they have like their blood pressure's up, their cholesterol's up, and they go to their doctor, oh, you got to take this so you don't get a heart attack, take that, you don't get a heart attack. You do a coronary calcium score, and it's normal. It's 0. You have no calcium deposits at all. Get rid of those medications. You don't need them.
Well, let me ask this quick question here, because Robert says he had a high calcium score of 1950. How can I fix this?
Okay, 1950. That's why you're here. The how can I fix this is the question, and that's why we wrote the book. Is to how do I reverse this? And 1950 is pretty high. So up to 100 is considered okay. 400 is high, like you're at high risk. 1950 is really high. So yes, you need to do something. You need to fix, as you say, that.
All right. Let me quick show you here. This is the Healthy Heart Solution Kit. So here's your solution. And you can get this at bartonwebinar.com or Barton Nutrition. But many of you already have this. This is one of our newest solution kits. Dr. Saunders helped put together, and this is what he recommends for his patients as well. So really good information in this. You can get the downloadable version right now. Well, okay, maybe not right now. You got to fill out some information, but then it'll be delivered to your email. You can download it, save it wherever you want to save it. If you want a printed copy, that is an option as well. It'll look like this. Lots of good information. We do talk about kind of one of the best parts is it tells you what you should eat, and then it gives you some recipes. So you can keep it real simple. And but Dr. Saunders goes into depth talking about why we're doing certain things, what's important, the effect of stress, and just a lot of really good stuff. So this is kind of where you want to go. This is the solution. You can save yourself a trip to the doctor's office. I think I can say that. Maybe Dr. Saunders can't say that, but I can. And so this is a lot cheaper. $19.97, friends. Can't do that. Can't do that anywhere else. So
you get what you pay for.
So, and all of these are blood tests, right? Basically, they can draw your blood.
Yeah.
Yeah,
they're all blood except for the coronary calcium score.
Okay.
Yeah, they're all blood tests.
What about like stress test? I hear about those as well.
Oh, okay. A stress test, gosh, what that means is they put an EKG monitor on and then they run you on a treadmill, or sometimes they'll actually inject you with something that causes your heart to be stressed. It's sort of like adrenaline that causes stress of the heart. And then they do or they'll do an echo. These days they do more echocardiograms than just the EKGs. And then while your heart is stressed, meaning it has to beat faster and pump the blood more because you're exercising, then they look and see if there's any dysfunction of the heart, either electrically with an EKG or by an ultrasound looking at the function of how the heart is working. So when people have like blockages that are only letting a little blood through, when you're resting, you're fine, no problem. But what happens if you need a lot more blood to flow through that little hole, then and it's not going to come, then you start exercising and then you get chest pain. I can't breathe, and you feel that chest pain. Then that's to indicate, oh, there is a problem here.
And are there two versions of stress test? Isn't one like I guess you were saying the injection, like my mother can't exercise, can't walk, let alone get on a treadmill. So that's the injection where they force your heart to beat fast.
Right. Yeah, they use like an adrenaline equivalent to make it beat fast. Now the issues there, and the reason I didn't even include that is because it's not really a predictor of heart attacks or heart disease or anything really. In fact, everybody does stress tests all the time. You just walk down the hall, go up the stairs, whatever you're doing. If you go, gosh, I can't even get top of the stairs, I get chest pain, I can't breathe. Okay, that's your stress test. You got a problem with the heart. It's not a test that helps.
Thank you for clarifying, because I think that's probably what some people have done. Doctors have told them, let's get a stress test. But there are a lot more better options to figure out how healthy your heart is.
Yeah. In fact, Joby said, can a stress test give you a false positive?
Yes, a stress test can give you a false positive and a false negative. So because heart attacks don't happen because of stable lesions or those deposits, like the guy that has his coronary calcium score is 1900. That's not the cause. Well, it's an underlying part of the condition. What happens is you're getting clots forming in there, and then you have a sudden heart attack, and it's not something that happens like gradually. Although you do want to open up those blood vessels, and so when somebody has heart disease, one of the things that they'll do is on the stress test, you're getting chest pain, and they give you nitroglycerin sublingual. What does nitroglycerin do? All it does is relax the blood vessel. And so if your blood vessels are tight and constricted and you take nitroglycerin, it relaxes the blood vessel. And then you could have a false positive if your blood vessels are constricted by the muscles are constricting the blood vessels.
Very interesting. This is good stuff.
Mhm.
Kathy says, I'm 73 years old. Yesterday, I was diagnosed with slight coronary heart disease. I have plaques in my carotid artery, but not totally shut. How do I try with food to rid of these plaques safely?
Wow. Okay. So use the book and go through the book. And the simple answer is to have a very high fiber, low fat diet, so that you're not getting enough fat in your diet, so that your body starts taking it out of the arteries. You also need to lower inflammation, so that it's a whole program on how to decrease inflammation. So how do I clean out my arteries? That's the best question, and that's why you're here. And that's why this is a discussion, a webinar, every week, and we'll do this for years. And we still won't discuss all of the aspects of it. So get the book, follow the book, and that's the best thing you can do.
Can we chat a little bit about our Healthy Heart supplement, Dr. Saunders? Why was this created?
The purpose for a supplement is to provide nutrients that you wouldn't normally get, and to provide support. It's not, people think, oh, I can just take this pill and my heart disease is going to go away.
Yeah.
Gosh, I hope you guys don't think that. That's not what it's for. It's really just as an aid or a help. So for example, we put stuff in there to help the adrenal glands to relax better, because if you do that, then you don't build up as much inflammatory markers, and when you're more relaxed, and the arteries don't spasm with, like when you have a bunch of adrenaline that's coming from your adrenal glands. So there's stuff in there to help the adrenal glands, and it's just a support. And then there's nutrients in there to make sure that you have enough of the things that are needed to have normal functioning heart.
Okay. I'm going to just read some of the ingredients here too. Let's see. We have beetroot, L-carnitine, ashwagandha, olive leaf extract, and coenzyme Q10. So if you've been hanging around these webinars for a while, some of those words probably sound familiar. And maybe some of you are thinking, wow, I'm already taking those in 4 separate supplements. I'd love to have it in one. Well, here's an option. So you can go to bartonwebinar.com and again, use that code webinar25 to save 25%. But this is one of our newest supplements as well, and just full of good stuff. So anyway, and I think this one is, let's see, you take 4 capsules once per day in the morning with food. Okay.
Yeah, it had to be 4 capsules because L-carnitine is actually needed in pretty high doses. So, we looked at other supplements to see what we could use, and they really just didn't have enough of the right nutrients or the right amounts in there. And then we wanted to add the adrenal support, so we put the ashwagandha in there. So this is kind of unique. It's not something that other supplements have.
You know what? I'm going to go ahead and ask this. We've been learning a lot about berberine, and that is another one of our popular supplements. Have you found any research about berberine and its effects on heart health?
Good question.
Oh, that's really interesting, because I wrote an article about berberine, and in the article I said, I don't normally write about a specific nutrient or supplement, but this one is so remarkable. Like specifically, like for diabetes, it lowers blood sugar. Longevity, it turns on everything that helps you live longer and shuts down everything that is associated with having a shorter life or causing cancer or something like that. It's great for cancer. It's been tested for cancer. And then after I wrote the article, and I said, it's pretty much good for almost everything. And after I wrote the article, I found another study on berberine and reversing heart disease. It actually gets the calcium out of the arteries. And that's something that I thought, wow, that really does. Yes. So it can help heart disease in that way.
Wow.
If you want to send me a little paragraph to add to that article, I will add it to the article. It's a Home Cures That Work article that just went live on Monday.
Oh,
Okay.
okay, cool. I was wondering when that was going live. Cheryl, tell us a little bit about Home Cures That Work, if you don't mind.
So it's a website that about home cures, and Dr. Saunders has been writing for about 15 years on many topics, on many subjects. We have other health experts. We've had nutritionists. We've had nurse practitioners write, dietitians, workout fitness people. And so there are a ton of great information. And sometimes the way we present it, if you have a question for the doctor and you can't ask Dr. Saunders, go ask Home Cures That Work, because there's probably an answer for Home Cures That Work on Home Cures That Work for your question.
I'm going to show you this. Hopefully it's working. Do you guys see it on my screen? Okay. So check this out. I love this. I remember even when I first started with Barton publishing in like 2012, this was, I like read all of these articles. This is where I got my education. This was before apparently we were doing YouTube videos, I guess.
Your college education.
It was. Hey, I learned way more from this. I shouldn't say that. I better not say that out loud. But it's true.
And
anyway,
and some articles are for free, some are for subscription. So you may be able to read some, and some others may require you to join. So there are links to join on here as well.
Look at this young guy down here at the bottom. Who is that?
Oh my gosh, that was a long time ago.
It really wasn't that long ago. But anyway, guys, such good information. Just another resource that many of you may just really love. So I think I was going to show you one more thing. Will it show, are you guys seeing my next screen at all?
Bart Nutrition.
Okay. So this is the other one that I wanted to show you. If you haven't been to our Bart Nutrition site, oh man, this is where you'll find all the things too. So these are the supplements that we offer. Again, Dr. Saunders is not a big supplement guy. Okay. So I'm just going to tell you that right now. He's very unlike most other businessmen, if I can say that. These are to help. Okay. These are the helpers. That's what I call this page. This is what I tell everybody. These are the helpers, and, but they're still really good stuff. A lot of this you might already be taking. So here's Berberine that we just talked about. I'm going to click on this and just show you something so that you can see how this works. All of our supplements have a video where Dr. Saunders talks about the product. So actually this came off of one of our webinars. I helped to put this one on here, but you can see, oh, someone said they didn't like it. Well, that happens. And anyway, good stuff. So that's the Barton Nutrition site. Use code webinar25 and you'll save 25%. All right. I had to have a little side thing here to show you all of that. But let's go through some more questions here. Velo and Barbie are here. They said, for anyone who is new, we are living proof that what Dr. Saunders teaches is real. If we can do it, anyone can. We love those guys.
Question from Doyle. What about high potato tioga level? That's Greek to me.
Me too.
How is that spelled?
TIOGA.
Gosh, I don't know what that is.
Let me look it up.
Kim says, I'm taking flaxseed oil, fish oil, and CoQ10. Are they good supplements for the heart? Yes. Fish oil is something that is an omega-3 oil. It decreases inflammation. And if you're not getting enough omega-3 in your diet, then taking fish oil is fine. And coenzyme Q10 is something that's made in the body. It's not a vitamin. And you don't really get very much from food, but some people don't make enough, and the heart suffers first from that lack of CoQ10. One of the problems is often people with heart disease are given medications that block CoQ10. So the cholesterol medications, for example, decrease your body's ability to make CoQ10. So you are more likely to get congestive heart failure if you take medications for cholesterol.
So that would be another good reason to take CoQ10. We'll probably have a whole webinar on that. And then what was the other one?
Flaxseed oil.
Oh yeah, flaxseed oil. So flaxseed, okay, that's interesting. So you have fish oil and flaxseed oil. They're both called omega-3 oils. But flaxseed oil is an omega-3 oil from, it's, well, vegan, it's a seed oil, as opposed to the fish oil, which comes from fish. Fish do not make the omega-3 oils. It's actually the plankton that make it, and they eat it. So if your fish are fed corn, for example, farm-fed fish, often they're eating corn, then they're going to have corn oil. That's what you're getting when you eat the fish, if that's where it comes from. So there's nothing magical about fish oil. It's just that fish eat or they get their oil up the food chain from the plankton that is good omega-3 oil. It's different. It's EPA and DHA. Those are the two types of oils, whereas the flaxseed oil is AA, arachidonic acid.
Interesting. Okay.
So you can take both of them together. That was my point. I was getting to that. Yeah, you can take both fish oil and flaxseed oil because they're different types of omega-3 oils.
All right. Let's see. Anonymous said last September, they told me I have a CT calcium score of 350. And then they told me I have stage 3 CKD,
chronic kidney disease.
Okay.
CKD.
What supplement should I stay away from?
Okay. Supplement, forget about that. You don't need a supplement. What you need is to find out why you have this, because if your coronary calcium score isn't really that high, like I said, up to 400 is considered. 400 is high. Over 100, between 400. Yeah. So that's kind of high. But the chronic kidney disease, that's a problem. And that means usually you have insulin resistance, because the insulin resistance will go up and be unmeasured until the actual blood sugar goes up. And then you have type 2 diabetes. Before you have type 2 diabetes, you have this insulin resistance, which causes kidney disease, neuropathy, and heart disease. So you have two of the three issues that may be related. So deal with that first. And so you go, well, how do I deal with that? Well, guess what? We have a webinar every Wednesday that we talk about it, is how to reverse that insulin resistance. So tune in on Wednesdays.
All right. I know I missed a question here. And actually, Bill had asked, is it possible for diabetes to be reversed?
Well, absolutely. I had somebody yesterday. She was talking to her. She was telling me about talking to her doctor, and she said, so the doctor said, well, you have diabetes, and she says, oh, what can I do about that? He says, take this pill, and she said, well, I got into this. Can't I get out of it? And he said, nope, nothing you can do. Just take this pill. And she said, well, what if the pill doesn't work? Well, then we'll give you another pill. And what if that doesn't work? Well, then we'll give you another pill. And she said, I don't think so. So she came to see me because she didn't believe what her doctor was telling her, that it was not reversible. So I explained to her that she could get back to a point where if any test for diabetes is going to show that she is normal, that she does not have diabetes, does that mean she's cured? Well, absolutely. So yes, it's reversible. Yes, 100%. Well, almost 100%. Type 1 diabetes is a little more difficult, but type 2 is almost all reversible.
Wow. This is an interesting question that hasn't come up. Is sleep apnea related to diabetes in some way?
Oh, thank you. That is a great question. Okay. The answer is yes. A resounding yes. Okay. So sleep apnea causes high levels of cortisol. That's the stress hormone. This waking up all the time, not being able to get deep sleep, you don't rest your body, and you never get anabolics. You're always catabolic. And we're going to talk about that at some point. We're going to discuss the anabolic versus the catabolic metabolism. The anabolic is when you're rebuilding and repairing, and that's while you sleep. But if you have sleep apnea, then you're not rebuilding and repairing, which means you're breaking down. And so that breaking down is partly what causes heart disease too. Plus, it causes the release of cortisol, and cortisol makes you insulin resistant. So you get diabetes from it. So yes, there's just an intricate connection between all of them.
Good stuff. Krish is on. Hello, Krish. A family member has been prescribed 5 milligrams amlodipine.
Amlodipine.
I've heard these. Okay, to lower blood pressure. Is this medication safe? I asked this question because I find conflicting information on the internet. Your input will be greatly appreciated. Thanks.
Okay. Is amlodipine safe? Well, that depends on who you talk to. And depends on the definition of the word safe. If you think that because you're taking amlodipine, you're not going to have a heart attack, it's not safe. It's definitely unsafe. Because it prevents you from actually dealing with heart disease. It actually reversing heart disease. Instead of doing that, if you're taking amlodipine, so that you can avoid reversing your heart disease, then it's not safe. Otherwise, 5 milligrams is a small dose. It's pretty innocuous as far as it is a toxin, but it's such a small dose that you probably won't get toxic on that much.
Right. James says, I can hear my heartbeat the last few months as if I have a carotid artery. Any way to begin clearing those arteries?
Yes. Get the solution kit, repair your blood vessels, clean out your arteries. And that's what we're talking about. And visit us every week and stay with the program. And that's the way to reverse this problem.
I think Doyle had said, let's see, what about high potassium and low sodium?
Okay, so high potassium and low sodium is an indication of an aldosterone problem. That's your adrenal glands. And so there's one other test that you need. You need a renin-aldosterone ratio if you have that problem. Sometimes it's a problem with the adrenal glands, and sometimes it's a different issue altogether. People, when they get recurrences of Epstein-Barr virus, their potassium goes up because the virus poisons the pump that gets potassium into the cells. So your cells start leaking potassium, and it raises the blood level of potassium. So the kidneys have to get rid of extra potassium. And was that understandable?
Good.
Okay, so that's the next thing to look at is the Epstein-Barr virus an issue? So if you have like fatigue, brain fog, and or big lymph nodes or something like that, you might have a recurrence of Epstein-Barr causing that high potassium. So it's important to look at why the potassium is high.
Yeah, and I feel like that's kind of the common theme with everything is you may have these symptoms, but it's important to figure out why, to really get to the root cause of it. And my recommendation, not that anyone else is saying this, wouldn't be to just take a medicine to cover it, right? It would be, let's figure out why this is happening. So, okay. Dr. Saunders, we've taken up all your time. You're awesome. And we're so thankful for this webinar.
Yeah.
Such good stuff. We'll see you next week. Cheryl and I are in here for just a second.
Yeah, Doyle, I put what he said to check your renal aldosterone levels. That's what he said. I looked it up. I Googled it.
Good. I want to see how that was spelled. Renal.
Yeah, me too. Okay. That's why I didn't take a stab at that myself.
I was like, wow, that's good. You really do know this stuff.
And you know, I just heard the other day about the Epstein-Barr virus that sometimes it's tick-borne related. It can be. They're saying even if you had a tick when you were 5 years old and never had any symptoms, there could be something that made it come up when you're 50. Like it may have been dormant for 45 years. So it's worth getting tested if thinks it's a possibility of having it.
Wow, that's so interesting. The body is just this amazing thing. I'm just blown away always. Let's see. I think there's one question here. Oh, I wish we could have gotten to this. Okay.
Save that for next week. Or
yes, let's do this. David, I want to talk about this next week. Like kind of how do you do both? How do you do the diabetes solution kit and the healthy heart solution kit? Which really is, how do I eat low carb and high fiber, right? And honestly, for both of those, that is the perfect world. I think that's what Dr. Saunders would recommend for everyone. And so let's talk about that.
I think you said last week, if you had to choose, do the diabetes one first.
Yeah.
Get your blood sugar under control and then go to high fiber, low carb.
Awesome. Okay. And one more thing. Let's see, Eric, Dr. Saunders, the Hall's meaning fast. What I've read the labels and looked at, all of them is measured the same thing. 1 teaspoon per serving. Oh, oils. Okay. The different oils that we're talking about, are they all the same? Maybe, is that what we're kind of, let's see. I'm not exactly sure, 100% sure what you're asking, Eric, but I do know that there are, we have talked about all the oils that Dr. Saunders would consider not good oils, and they typically start with S. Is that right? Isn't that kind of how it is?
Seed oil,
way.
right? The seed oils.
Yes. So, sunflower, safflower,
Canola oil, that does not start with it starts with a C.
Okay, so I don't know what I'm thinking. Canola,
Soy.
yeah, those are the no's. Okay, I think that's it for today. You guys, this was great. Cheryl, thank you so much again.
My pleasure. I love being here with you guys. I learned so much. I took notes if you couldn't tell.
I know, me too. I know. I just learned so much all of the time. So we just love this. All right, guys, come back next week. Share this with a friend. And again, head to bartonwebinar.com. You can go watch the past episodes if you've missed any of those, and be sure to subscribe, and then you'll get notified anytime we upload any new webinars. All right. We'll see you guys next week. Thank you so much.
Bye.
Bye-bye.